enter the room.
Hello, good morning.
Good morning.
I'm one of doctors in the emergency department. Are you Emily Brown?
Yes, doctor.
Could you kindly confirm your age for me?
I'm 30 years.
All right. Emily, I can see from my notes here that you were admitted in the emergency department with some tummy pain and vomiting. Can you tell me a bit more about that? What happened to you recently?
I just want to go home, doctor.
All right, Emily, definitely, surely I would be able to help you with that. But before that, I would like to ask you a few more questions to understand the whole situation better and whether you're fit to go home or not. Is it okay if we continue?
Oh, okay.
So kindly tell me, what happened to you recently? Why you were admitted in the first place?
I have this abdominal pain and nausea for the past few days, doctor.
Oh, I see. Okay, I'm sorry to hear about that. So, also you can see from my notes that you have been diagnosed with a condition called diabetes.
Mm.
So can you tell me a bit more about that? When this diagnosis was made for you?
I have type 1 diabetes for 5 years now.
I see. Okay. And were you taking any medications for that?
Yes, I'm taking insulin.
All right. And were you regular with your insulin medication?
Well, no, actually, I missed my doses because I'm really, really busy with my children and work.
Oh, I see. So you are not regular with medication, is it right?
Well, I used to, but last 5 days I really couldn't.
Oh, I see. Okay, okay. Okay. I also would like to ask that are you regular follower with the diabetic clinic? Do you go there?
Yeah.
I see. Okay. And do you have a glucometer at home? Do you regularly check your blood glucose at home?
No, not regularly, but sometimes.
Sometimes. Okay. Okay. So you mentioned that you were not able to take insulin for 5 days, and so
Mhm.
when this tummy pain and this vomiting happened, since how many days?
For a few days, and yeah.
Hmm. Okay. And so when you were admitted in the hospital, what was mentioned to you? What is your understanding of your condition?
I had some burning pain when I was passing urine too, so they said that I might be having a urine infection.
I see. Okay, all right. And how are you feeling now in terms of your symptoms?
Um, I'm not perfectly okay, but I really need to go because my children are at home.
I see. Okay, I do understand that you want to go home. So can you tell me who else live with you in your home? Do you have any help available at home?
No help at all, doctor.
Okay, and what is the age of your children?
4 and 6.
Okay, and how about your partner? Is he not with you at the moment?
He's with me, but he's also working.
I see. And do you have any family and friends around you to support you in this time?
Nobody at all. No, nothing. Nobody.
Oh, I see. Okay, okay, I see. But don't worry, Emily. Definitely, I'm going to talk about it.
Mm-hmm.
But before that, I would like to make you understand that once you were admitted in the hospital recently with this infection, you developed a complication of diabetes called diabetic ketoacidosis. Have you ever heard about this before?
No.
Okay, so basically, this is a complication that happens when we are not able to take our insulin properly, and sometimes infection with us, as you mentioned, you got recent infection in the tummy and you got burning in the urine as well. So this can lead to this complication. And Emily, I'm sorry to tell you that this is a life-threatening situation. It's a kind of medical emergency.
Oh. Okay. So I can't
So,
go home.
yes, Emily, I'm sorry to tell you, but your safety, your life is the topmost priority for us. And so it's very important for you to stay in the hospital so that we can carry on with the necessary treatment that is needed for you.
Oh. How long do I have to stay, doctor?
Okay, so Emily, once we will keep you in the hospital, we will continuously monitor your symptoms. We will regularly check your blood glucose levels, your vitals, and also we will start you on some fluids through your veins and insulin through your veins. And we also will like to balance the salt imbalance that is happening in your body happen. But you are in safe hands at the moment, and we are trying our level best to give you the necessary treatment at this point. And that's why it's very important for you to stay in the hospital to get the proper medicines
Um,
and treatment for that,
okay.
so
I,
that your condition gets stable.
I'm still not sure what to do for the kids, doctor. I'm really worried about them.
Yes, Emily, I'm going to explain some options for you.
Mm,
So, okay, you mentioned you don't have any family or friend. How about your partner takes some off days or to take care of the kids? Would it be possible for him?
I'm not sure. I'll ask him.
Oh, yeah, definitely. He can talk to his employer, tell about the whole condition. Maybe he can get some compassionate leave, or maybe he has some off days, so he can utilize them. And in some other case, we can also take help from the social services as well, and they can arrange some alternate arrangements for your kids while you are in the hospital. So, Emily, yeah, there is support available. So definitely
Mm,
we can explore options for you together.
okay, that's great.
Yeah, Emily, do you have any other questions or concerns for me at this point?
Um, yeah, so that's my main concern about the kids and about this condition. So, mm, yeah, that's all.
Okay, Emily. So, while you're in the hospital, we're definitely here for you. And if you feel like your symptoms are worsening and you develop some severe tummy pains or high-grade fever, don't hesitate to give us a
Move
call.
on to the next station.
Not bad, guys. Good job.
And
Good job.
sorry, this is my first time, so I hope I did well. Sorry if I
Yes, yes,
missed anything.
absolutely. And good job. You kind of filled in the information that was not there. And Suman, I have to say, good job. Especially, this is very important that you don't interrupt the patient. At your, even though time was running off, you actually managed to let her finish. That's incredible from your side to actually show that patience. That's awesome.
Thank you so
But
much, doctor. And today, I did not follow the script. I just followed the patient. I tried to.
and yeah, I think you did cover a lot of good points. See, you understood the main concern. Even Dr. Abraham was also saying that. He's the one who marked. So that's the main thing, right? If you continue asking that concern, they'll keep saying what is the most worrying thing for them. And at this point, you understood that the most worrying thing was the children, and you brought in management for that. Good job on that. I was wanting to see whether or not you do that. Towards the end, you actually brought in that fact that okay, we'll try to help you out. How about we, understand your family situation, and if there is any, help that we can avail from social services as well. So absolutely. So that's what, no, in these patients who are refusing to getting admitted, couple of things you need to understand. Number one, why are you refusing the admission? Number two, do you know what will happen to you, if you're not treated properly for this condition? Right. This is how you assess their, mental capacity. Like, are you able to, live with the fact that there will be life-threatening complications if you do this? They need to be aware of the complications that may follow if not done as advised, right? So instead of saying directly to them that it can cause death, you want them to understand that. So the best way to actually do that is, do you know what happens? And if they say, it's okay, doctor, I can deal with it. And then you can bring in the fact, unfortunately, this is such a serious condition that blah, 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 right? The fact that, you may actually die and all that, right? So you need to give them the worst possibility. So when it comes to patient refusal, if they're not refusing to be admitted or treated, you need to give the most, the worst complication of the disease. You have to present them with that, saying that this is a possibility that can happen. I just want to make you aware. I just want to make sure that you have all the information before you make this decision of not, getting admitted or not wanting to have treatment. All right. So that's one of the ways of actually convincing them. So if they are actually able to make peace with the fact of the worst complication that can arise due to the disease, then there's nothing you can do. If they're still agreeing to the fact that, all right, I know that this is going to happen and I still don't want to get admitted, you can't do anything. Right? This is actually giving autonomy to the patient itself. They have to be aware of their condition, the complication of their condition, and still, if they refuse treatment, there's nothing you can do. All right. So this patient actually got convinced. That's good, right? You have to actually keep arguing with them until they get convinced. Usually it takes a lot more effort. Like definitely they'll be like, no, what about my kids? What about? And then you're looking for ways to help them so that they are not that worried about their kids, right? And then you actually present them with the worst, possible outcome, due to treatment refusal or admission refusal. And still, if they still feel that, no, doctor, I think I can go home and I can take the medication from there, then you need to bring in the fact that we need constant monitoring. So along with treatment, if you are not monitored, a lot of complication can arise, because the treatment that we are going to offer you needs to be done under supervision, expert medical supervision and monitoring. All right. So that's also another conversation that can come, that, no, doctor, I'll take all my treatment from home. I'll do it at home. So you have to actually tell them why the monitoring and the expertise is involved. I mean, needed in this kind of a condition, right? All right. Awesome. So this was DKA. So guys, let's hear about DKA. What do you guys know about DKA? What are a couple of symptoms and what are the complications that you're trying to avoid? Anybody?
Yeah, Dr. N, I think I missed one important point. DK can lead to coma. So I think I did not mention in my consultation. DK, the most complications, it can lead to coma in the patient, right?
And that is something that you can tell her,
Yeah.
okay, towards the end. I mean, it's life threatening. You can actually go to the fact that it can cause death. I mean,
Yes,
coma is like
exactly.
a step ahead. I mean, little less than that. But you can actually go to the point where you can actually tell her that this can actually cause you your life, right?
Very right. Yeah.
And also you can start with coma, you can start with other renal complications, cerebral edema and all that stuff. So that is complication. What is the treatment complications? What if she says that I want to go home and get all the treatments done? So in this case, you have to say that the treatment is
Yeah.
basically you have to
Through
give.
vein. Yeah, we have to like keep you, because we need to give you fluids and insulin through vein. You can that is, I think that is not possible at home, right?
Yeah, absolutely. Now, who's going to be poking them at home?
Yeah.
That's very true.
Yes.
Like that's what it's like. All the what is it, invasive treatment and all is only done in the hospital. But what happens if you take insulin? Like you will be giving them a lot of insulin to bring down their sugars. You see, this lady's sugars is something like around 30. Right? This
Yes,
is
I think the regime was insulin will be given, and along with this, regular monitoring of glucose, some glucose will be given, and then potassium should also be given, potassium chloride.
potassium chloride. Absolutely. There you go. So what happens when you give insulin is insulin causes peripheral uptake of glucose, and also it causes intracellular uptake of potassium. So you will be drastically losing potassium. In fact, in the ICUs, even if a patient does not have DKA or any glucose condition, if you see that the potassium is very high, you give insulin as the treatment. For high hyperkalemia, the one of the treatment is insulin. In this case, let's look at the potassium of this patient. In this case, potassium is in the normal range. So if you give insulin, potassium is going to drastically drop. So hence you have to monitor them for these things, not only fluids, not only electrolytes, you also have an aspect of metabolic acidosis. Now, metabolic acidosis, if it gets really bad, it can actually cause renal damage. Not just renal damage, it can, I mean, it's like an acidic environment that's building up in your body, in your system. So it can have like a global effect throughout your body. It can also cause cerebral hyperperfusion and so much more, right? So this is a very dangerous condition that needs immediate intervention. And even in the intervention, so much can go wrong because mainly it's fluids. Now, if you don't do fluids properly, if you're giving fluids in a higher rate, it can actually cause cerebral edema, it can cause pulmonary edema. So it needs to be like continuously monitored along with the urine output. So it is a kind of treatment that you have to continuously keep monitoring on the results. So you keep taking blood every 1 hour, every 3 hours, depending upon the response, and then you'll be changing a management plan while you're actually doing the intervention. All right. So I just wanted to put it out there, especially for DKA. All right. Let's look at the performance. Dr. Ibrahim, were you able to mark? Awesome. All right. So confirm the patient's symptoms and duration of abdominal pain and nausea. That was done very well. Path medical history, condition, and medication. Understand the social support. That was very well done. Explore the reason for missed, doses and assess the adherence. So I think this was actually mentioned. She did say that, I have been busy, very busy with work and my children lately. And actually, maybe the duration of how much you missed might have been important. Like how many doses you missed
I
would
think
be
she told me since 5 days I'm not taking insulin.
okay, great. Okay, so that was explored. Yes. Then inquire about any recent infection or trigger. So in this case, what was the trigger? I think you actually found that out, apart
She told
from
me about vomiting and UTI.
UTI. Did you give anything for UTI?
No, I think I did not. Not in the management.
Yeah. So there you go. You found out that she has UTI. Her nitrates were, I'm sorry, her leukocytes were also high, suggesting that she has UTI. If you see the results, and still that's what once you understand these are the issues, you have to treat all the issues. So apart from treating the DKA, you had the UTI also to take care of. I know this case can be a little, it might take you elsewhere, but that's what you have to keep in mind. What is the trigger, right? And you have to inform the patient about the trigger. She has two triggers, and I mean she has two risk factors in this case: her non-compliance and also the infection. Right. So you have to make sure that you tell her that these are all the triggers. And so far you've had these two risk factors, and that's what probably has caused you to have this condition. Right.
Begin. Enter the room.
Yes. So I just wanted to show you this. So leukocytes is also positive in this case. So in this case, nitrites was negative and leukocytes is positive. Does this actually mean UTI? Actually, it does mean it is UTI. So nitrites is something that is actually produced by a gram-negative bacteria, and most of the time UTI is, it occurs because of E. coli. Maybe this was another bacteria which was in gram-negative. So it doesn't tell you the bacteria, but it kind of gives you that there is UTI for sure. These are dead white blood cells. So yes, if you actually find them, you need to have a suspicion of UTI. All right, so moving on. So ask about the burning sensation and passing urine, other urinary symptoms. All right, like the extent of UTI. Are you actually having the back pain? Is it like just the UTI, or is it something like lower UTI, upper UTI? To just understand the extent where it's affecting. Otherwise, review the patient's understanding of DKA and diabetes management. This is what is important. You need to understand, do you know what this condition is? Do you know what happens if it's not treated? Especially if it's not treated in the hospital, right? Like, what do you understand about the treatment of this condition? Like, could you tell me a little bit so that you understand it? She actually offers to say that I'll go and get treatment at home. Like, all right, could you just tell me what you understand about, the treatment for this condition? And then she'll say a whole lot of things. It's okay, doctor, I'll just take a few medicines at home. Then you can actually bring in the fact of what all systems are affected in this case and how you need to treat this or else the potential complications, right? Find out more about the activity of daily life if there are any stressors, because stressors are a big risk factors when it actually comes to, the DKA. Yeah, conduct focus abdominal examination. I think you did an abdominal examination, but unless you actually do the
He didn't
exam,
examine the patient. He
all right. Okay, yeah, okay, okay,
No,
okay.
I think I did
didn't
not do
review
the live
the
examination.
she
I thought
didn't review the result as well. She didn't explain the result to the patient. She just said it has. That was why I was confused marking her script.
I see.
Sorry, I was a bit
no,
miserly
no, no.
in this one.
Mhm. No,
Actually, in this case, what happens is the blood test reports and the ABG is already there in the cubicle. So you can
mhm.
actually do that. But any further examinations, if you need to do, you need to verbalize. So I had no way to actually show you that. So that's why I just opened up the whole thing and I showed it to you. Right?
Okay.
Yeah. Yes, Dr. Ibrahim, you have a question. Please go ahead.
Yes, Mom, I was just hoping, even if the result is there, is it not
Mhm.
our duty as the doctors to explain to the patient, okay, now I'm going to be discussing your result with you. Here I can see you have this, you have this. Is we're supposed to be seen saying that to the patient, even though it's there in the cubicle, isn't it?
Yes. Yes. So in this case, what is the thing is that if all the investigations kind of, indicate that it's DKA. And this is a case that it's DKA, the patient also knows it's DKA, but it's come to the point that she's refusing treatment, right? So this is actually a place where you're not explaining the diagnosis, right? You already know the diagnosis, she also knows the diagnosis, she's refusing treatment. So this is the part after that, like how this is actually to help you understand like what is the extent of the DKA. Right, so you can actually use this to help her tell her that the blood test that we did show you this. So these are supportive, measures that you can actually show. What you can do is you can do the examination to see how she is currently doing, right? Like the abdominal examination, you can actually understand, do to understand to see if she's currently having any abdominal tenderness or pain, right? So to assess current condition, definitely go ahead and do examination. But this scenario is treatment refusal after the diagnosis. So we kind of know the diagnosis. In most of the cases, when you are required to explain the blood results, you are coming to the diagnosis. Do you understand what I'm trying to say? You're trying to say that you have this particular condition because blah 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 blah. We've seen this, right? We've seen this.
Yes, 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 Dr. N, I understand. Like in this scenario, we have the results, but there will be no time to explain the results because like, first thing is a refusal session, and
Yeah,
second thing is like it's not we don't have to diagnose it. We already know the diagnosis, right?
yeah,
But
we know
this is
that.
just for our confirmation that she has developed DK. This is for us
Yes, but you can use those, information to
to
actually tell
convince the
the
patient.
severity.
Yeah, if she doesn't agree. Yeah.
Yeah, like you see the severity with the blood results that we did, it's actually showing that. So you can actually use that help, you can use the help of the results with that. Okay, Abraham, you have something to say. Go ahead.
Yes, Mom, like you've just said what I wanted to say. Like, even if we are not, it's not a result sharing station, we can use the findings when
Yes.
she's refusing to emphasize, okay, your WBC was 18, on that it was high. So, and
Mm-hmm.
considering she's diabetic, oh, give me antibiotic, I'll go home and take it. For the
Mm-hmm.
way the condition is with you at this moment and your diabetics, like, it
Mm-hmm.
doesn't give you the room to start with oral antibiotic. So
Yeah,
I- just a way to express for her to understand the need she need to stay in the hospital. So I think
absolutely.
if we mention it, at least the examiner will know, okay, this
Yeah.
candidate is reflecting on what is there and is using it as a yardstick for convincing the patient based on that.
Absolutely, absolutely. But when it comes to explaining results in stations where you're required to explain the results, make sure to explain all the tests that was done, all the negative and positive results. All right, because they want to know, like from the patient's perspective, they want to know what all tests were done and how much of it was negative and positive, and make the interpretation of that. In this case, you won't really get time to do that much, right? So use the information to help you convince the patient. So yeah, that was important. That was a good question, actually. All right. Let's look at the management. Any important strategies?
2 minutes remaining.
Abnormal parameters, emphasize on the stress on the importance of admission and correction of all the abnormal parameters. Yeah, this is again one place where you can actually bring about what all were abnormal in the blood findings, right? Emphasize on the necessity of hydration and infection control. Yes, again, you have to control the infection so that you don't get triggered, right? So we need to make sure that the infection that you came in with is been treated. That's also very important. Underlying antibiotics, yes, for the underlying UTI, right? Start insulin, yeah. Yeah, you can actually say that we'll be giving you insulin through the veins actually this time to.
I think, Doctor, I did mention that. I insulin. I did mention that. I don't know. I did
Through
not.
the veins and
Oh,
all that.
maybe I didn't hear that.
Yeah.
Sorry.
Well, that's
I
okay,
can
but
add one more mark for you. Sorry.
No worries. It's fine.
She did that. She did mention it.
through the veins was mentioned in this specifically.
Yes, I remember.
Yeah, she remember. Yeah,
That's
she
like
mentioned.
another important thing, you have to be giving, because otherwise they're actually used to giving it, like intramuscularly. So this time you're actually telling them you're actually giving a different route of administration itself, right? Correct electrolyte imbalance, discuss the importance of regular insulin management, administration. So from now on, you have to even give her the advice on why she had this condition in the first place. All right, so saying that you have to be compliant with your insulin intake. Yes, Dr. Ibrahim, you have a question.
Yes, mom. You just mentioned intramuscularly. Is it for insulin? I thought it's
Oh, sorry, subcutaneously. My bad. Good catch. Absolutely, yeah, it's subcute. And yes, Dr. Ibrahim definitely keeps me sharp. All right, provide information on recognizing early signs of DKA. So if you have again, so since you've had this condition, if this is to happen again, this is a good safety netting. You can actually do that next time if you have such sensations of, nausea, stomach ache, please do, intense feelings of those, please do come and visit the hospital immediately. And that was a good question about whether you have a glucometer at home and all that, right? Because that is something that you can ask them to do for an immediate management. If something like this happens, it's a good thing to actually check your glucose level at that time, right? And if it's too high, you can come to the hospital, right? Even though it's not in the Canada information, if this is something that you manage to gather from the patient itself, that they have something like this, an apparatus at home, and they can test it, it's better to test it, when you feel such uneasiness, right? Arrange follow-up with the diabetes care team, offer diabetes educational resources and support. Yeah, I think towards the end you kind of missed out on time, but that's all right. You were actually waiting for the patient to answer. That was pretty good. Yes. Yeah, absolutely. Interpersonal skills was pretty on point because you literally understood the concerns of the patient, and that really showed. So good job, Dr. Saman, on doing that. All right, that was a very interesting case.